learning outcomes for the module on aseptic non-touch technique. In this module, we will cover the following points: clean hands technique, patient observations and communication style, preparing trolley before conducting the ANTT procedure, dressing and precautions during the process, closing the procedure properly.
So this is the ANTT procedure, and I'm going to start with hand washing, and we're going to go through the 7 steps of hand washing so we got it correct from the start. This has got to be done in every scenario, so it's important to get it right, but it's particularly important at ANTT to get every step, do it for 30 seconds at least, and get all those steps in. So and first of all, I'm going to go through that. So it's palm to palm, back of the hands, fingers interlaced, back of the fingers, fingertips to palms, thumbs, wrists, and let your hands dry for at least 30 seconds. So I declare the area safe before I approach the patient, and I would introduce myself. So I'm going to assume that all the introductions have been done, the identity checks are correct, and that the patient has consented to the procedure and understands what's going on. I've checked for pain and the patient is comfortable. They're okay in that position and the bed's the correct height for me. I would ensure that the place is screened, so curtains are closed, windows are closed and doors are shut for privacy and dignity. And I'd also ensure that the cleaning's been stopped for 30 minutes and the fan's turned off to let the microbes settle. I would then, after having told the patient what we're doing and got consent, I'd explain to them it's going to take about 15 minutes, the procedure. If you'd like to use the toilet, and give them the option. If they want to go to the toilet now, it's a good idea. So the patients agreed to everything, and I'm going to go away and get my stuff together. Okay. So when you're leaving the patient area, make sure you gel your hands again. This is just a quick social hand wash. You don't need to do the 7 steps again. You will use a silver trolley like this one. So I would check with the examiner. This trolley has been cleaned with soap and water in the past 24 hours, but I'm going to give it a wipe with 70% alcohol wipes, like these ones. I would put my apron on now. You do need to wear an apron for this procedure, and you only need to put 1 apron on. You don't need to keep changing your apron. You can wear gloves to protect your hands to clean the trolley, but it's not absolutely essential to wear gloves to clean the trolley, but I'm going to wear them anyway just to protect my hands. So open the wipe up wide, out wide, so you can cover a greater surfaced area. Clean the trolley in a zigzag manner from the furthest part away to the nearest, and clean those end bits individually. There's a dressing bar that you also need to clean, and clean the legs of the trolley. This can all be done with the same wipe. That wipe now goes in the clinical waste bin, the yellow bin, as we call it. And do the same with the bottom trolley shelf. So cleaning the shelf from the furthest part away to the nearest, not missing any areas. And don't bother doing the bottom parts of the legs, that's unnecessary. I don't need these gloves now, so I'm going to take them off. For good practice, get used to just gelling your hands before and after you take gloves on or off. So the trolley, I would assume now, is dry, and I'm going to choose a dressing pack to do the procedure with, and this one's intact and it's in date till 2022, so July 2022. So I'm happy to use that one. And I'm going to use some cleaning agent, which is Normasol. It's just normal saline, and that is clear. The sachet's intact and it's in date till 2020. It's 11/20/20, so I'm happy to use that one. And I'm going to use a pre-injection swab basically, which is another alcohol wipe, but of a small variety. And that is intact and it's in date till the 9th, 2022. And of course I need a dressing. So here's the dressing, it's intact and it's the same one as in the care plan and it's in date till July 2021. I need to take some alcohol gel with me, and that's everything I need for the dressing. So I'll return to the patient. So are you still okay to go ahead with the procedure? Patient has agreed to go ahead with the procedure, so again I'm going to shut the door and make sure that the area is screened for privacy and dignity. And I'm just going to lift the sheets back to the area where the wound is, and it's on the lower leg. I only need to expose a minimum part of the leg. I don't need to take the sheet right up. And you can see it's covered because it looks like somebody's just come and had a look, a doctor's just come and had a look and took the dressing down. So we've just got a sterile sheet covering it now. So I will go ahead and gel my hands because I've touched the patient. And I'm going to open the dressing pack. Ensure you don't touch the clean trolley with the outer packaging. You can just pop that down underneath the on the bottom shelf, and just gel your hands again before you open the pack. So touching only the green under part of it or the very edges. Best way to get this to sit flat is actually to pull the edges nearest to each other, and then it should sit nice and flat. So again, I'm going to gel my hands and I'm going to take the bag and use it as a sterile glove to arrange this sterile field, touching only that red line or whatever colour line it is, whatever bag you get, and wear it as a glove like that. I'm going to arrange the sterile field. It won't take too long doing this. You can loosen up the gauze now as well, just to have it ready to clean the wound. And with the gloved hand, well, the bagged hand, we're going to take off the sterile cover for the wound and stick the bag to the dressing bar, not touching the bed. Do not allow it to touch the bed. Again, gel your hands. Open the dressing and put it onto the sterile field. You don't need this till the end, so you can put it out the way somewhere on the sterile field. This can either go in the bag or again, you can just pop it underneath. Open the stirret or alcohol wipe And I'm going to verbalise to the examiner, I'll clean this for 30 seconds. Can I assume 30 seconds has gone? And the examiner will say yes. And I'll let this dry for 30 seconds. Can I assume 30 seconds has gone? And the examiner again will say yes. So I'm going to open the sterile water and pour it into the tray. Put the plastic in the bag and again gel my hands. Once again, you don't need to make a conversation with the patient. They're not really testing your communication skills here. Just try and get the procedure done clean and correct. So I'm going to don the sterile gloves now. So obviously I've just gelled my hands, very important. And going to open the sterile gloves. I'm going to so there is a method to donning sterile gloves. First glove, only touch that lipped part, the inner part of the glove. Second glove, fingers underneath, so the outside of the glove to the outside of the glove. And now, once you've got the sterile gloves on, just pinch the middle bit and throw it down there. You don't need it now, okay? So I would obviously communicate with the patient at this point and say, I'm just about to clean your wound. So just to let you know, it might be a bit cold. I'm going to use the clean hand, dirty hand technique. So the clean hand will only ever go to the tray, to the sterile field, and the dirty hand will go to the patient. And I'm going to pass the gauze between them. I'm going to clean from the cleanest to the dirtiest area. And it's going to go straight into the bag. Cleaning the outside of the wound. And gently irrigating the top part of the wound, just keeping it moist. And cleaning and drying the outside parts of the wound as I go. And I'm now going to put the dressing on. So you can use both hands for this part. Just going to place the dressing on. That's on nice and secure. Now, it's absolutely essential you do not cover the patient up with your gloved hands. That will be a fail. So what I'd like you to do is fold up the dressing pack on top of the trolley. Get any rubbish. Take the bag, put it on top. Put everything in the bag, including the gloves. It's absolutely essential that you get rid of the gloves now. Put it in the yellow bin, which is the clinical waste bin, or if they had an orange bin, you'd use that, but I'll assume they'll have a clinical bin that's yellow for now. And I'm going to gel my hands. So the dressing's on now. I'm just about to cover your back up. So I replaced any sheets or clothing, and I'm going to offer the patient the buzzer and tell them what I've seen about the wound. So the wound itself is healing nicely. There's no signs of infection. There's epithelialization taking place, so that means there's healing. The wound's coming together, the corneas are coming together nicely, and it's looking very good. So we'll come back in a few days and change the dressing for you. If in that time the dressing was to get saturated with blood or water, or it seems like it's soaked with exudate, let us know. Also, if the wound did become very itchy, swollen, red, also let us know, so we would have to come and have a look at that. For good wound healing, it's a good idea to drink plenty of water. 2 to 3 litres a day is ideal, and eat a good nutritious diet full of vitamins and minerals and protein, and that will aid wound healing as well. So I'm just going to go away and get rid of this trolley and document in the nursing notes. If you have any questions, please do ask, and I will come back and see you within an hour or two. If you need us in the meantime, please do press the bell. Okay, thank you. And at this point I would get rid of the apron as well. It's the gloves you need to remove before you touch the patient. And I would take this trolley away and I would wash it with soap and water, gel my hands, and that would be the end of the procedure.